Okay, so this is a phase 2 study of Zanidatamab combined with standard of care chemotherapy. And in this study, it involved 3 standards of care because they vary across Asia and North America and even Europe. So we used CAPOX, FOLFOX, and FP. So combination of Zani and those 3 chemotherapies in patients with metastatic or unresectable gastro-oesophageal adenocarcinoma. So this was a phase 2 study done in 2 parts. In the first part, we could include patients based on local HER2 testing results. In the second part of the study, all HER2 testing results had to be centrally confirmed. It was a physician choice of chemotherapy, and the primary endpoint of the study, as it is in most phase 2 studies, was overall response rate. The secondary endpoints included, the progression-free survival and overall survival. So I think it's a pretty exciting study. The overall response rate was 84%, and this study was done at the time, of course, where IO was not approved, right? So this is just Zanidatamab with chemotherapy. We saw a duration of response which was meaningful. It was about almost 19 months. The progression-free survival is also very meaningful. It's 15 months, and the overall survival, the median overall survival, is not yet reached despite 3.5 years of follow-up. So that was a little bit unexpected, but also good news. So the drug is safe. I will tell you that we did have to introduce, the primary issue with the use of this drug is the incidence of diarrhea. We did have to introduce loperamide prophylaxis, probably around halfway through the study. Once loperamide prophylaxis was introduced, the incidence of grade 3 diarrhea went down to 14%. So that is quite manageable, but this drug does require the use of loperamide. So the next steps are already ongoing. The Horizon GEA phase 3 study is ongoing. Obviously, the results of this phase 2 study are promising, but what you need to make something a new standard of care is a confirmatory phase 3 study. And we hope that that study will finish enrolling at the beginning of next year. Well, I certainly hope that we're going to have a new standard of care in my patients. Look, I'm a medical oncologist who treats gastroesophageal cancer. And I'll be very honest with you, for a very long time, we've had very few treatment options in these patients. So for me, it's very exciting to see all of a sudden all of these new drugs, including Zanidatamab. So I certainly hope it will be the new standard of care. But as we all know, we never know until the phase 3 study reads out.